there are resources out there. I think that the main thing is that that we were talking about before is that it's very isolating. There's shame associated with it, unfortunately, still in our day. And I think that what I would tell them is to dig and to do their research, because there are resources out there. There are people and organizations that are willing to help, whether they find out through their clinic, through their physician, nursing, any staff at the clinic, or doing their own research. There are more and more resources out there to support you.
Hello, everyone. We are so super excited to be here with you live, and it is the Canadian Fertility Awareness Week. And why not end off the week talking about IVF? Because here's the thing, it is really expensive, and Dr. Tanya Wild and myself know, because we have gone through it before. Even though we're in the health industry, like in the natural way of doing things, we both surrender to IVF. But that's not the purpose of this talk. Today, we're talking about how it can be inaccessible to a lot of people. So we've brought in a fantastic special guest who's a fertility doctor, Dr. Chloé Roumain. And I'll have Dr. Tanya Wild introduce you, because we're super excited having you.
Yes, we are super excited. Dr. Chloé Roumain, I love your name, and you are from Haiti, which is super cool. I want to hear a little bit about that and your history there. I'm going to introduce you. You were, as we know, or we've learned very early in life, when she had chosen the path she would take as a career, Dr. Roumain determined that she needed to go into pro bono work in her native country of Haiti, where there was like a shortage of access to healthcare, which is tremendous that you went that route and helped out. And however, after completing your medical studies and specialization in Canada, Dr. Roumain was not able to practice in Haiti due to unforeseen circumstances. In her present work, Reality, Dr. Roumain found that there was inequality among her fertility patients, which led to the creation of Fertility Friends Foundation, which is such a big deal because in Ontario, there's difficulty accessing, fertility even today, like amongst, patients. I see that all the time. And as Mary mentioned earlier, we both went through fertility, and at the time, it just seems like a very big cost, and there's a transition. So you might be doing IUIs first and then going into IVF. So there's costs with that. So we want to hear all the scoop on that and how you are helping with getting patients access. And we witnessed those financial struggles. So perhaps you could tell us a little bit more about your history and helping out in this foundation that you created. Thank you so much for joining us.
Absolutely. Thank you. Thank you so much for having me. Good morning. So as you said a little bit in my bio, I was born and I grew up in Haiti. It's unfortunately a country that has a lot of struggles. And growing up, I always, for as long as I can remember, I wanted to be a physician. But I also witnessed the inequalities in access to everything, to be honest, but in healthcare specifically. So my plan was to become a physician and then go back to Haiti and give back as much as I could and do pro bono work. But unfortunately, the circumstances in Haiti changed as I was training, and it became very difficult to go back. Also, I ended up marrying a Canadian, so I also, on a personal level, ended up adopting Canada as my home country. And so, but I stayed, with that desire of trying to help those that are not able to afford healthcare. In Canada, we're very lucky because of social medicine and healthcare and most things being covered. However, fertility is not one of those areas where everything is covered. In Ontario, as you mentioned before, there is some coverage, but a lot of the times patients have to pay for most things out of pocket for fertility treatment. I initially trained in Quebec. So when I came to Canada, I was in Montreal first. So that's where I went to medical school and also did my residency in OBGYN and my fellowship in fertility as well in Montreal. And ended up moving to Toronto about 6 years ago. now. So I've mostly practiced here. So as soon as I finished my training, I moved to Toronto. So as a practicing physician, the reality that I've seen is the terrain here in Ontario. So I don't know if everyone knows this, but there is funding in Ontario for anyone who's a female resident with an OHIP card under 43. You're entitled to have one funded cycle of IVF. So that's the funding that is available right now from
So
the
let's
government.
break that down. Let's break that down. And just so you know, Dr. Roumain, I actually sat on the expert panel. I was chosen by the government, and there was 12 people, and we actually suggested 3 IVF for funding, but thankfully we got one, right?
Okay.
So, and that was, I think, back in 2007 and something like that. And so we're grateful for that. But we need to talk about the real costs. So even though it's funded, we need to know the reality of what actually funding is, because to me, it was like, that's actually a discount versus everything completely free, right?
Right. That's actually a good way to put it, because when so in my practice, when I see patients, initially you don't expect when you train in Canada to be talking about finances so much, right? But in the field that I'm in, after every consultation, it's part of what we talk about. We can't avoid it because patients have to figure out how to pay for the treatments that we recommend. And so even if somebody is eligible for a funded cycle, what we have to understand is that the funding, like I said, covers only one cycle. So that's an important point because you may need more treatment. It also doesn't cover everything within an IVF cycle. So it won't cover meds. So the medications are quite expensive. You're looking at could average around 5 to all the way to up to 8,000 for medication. Could be less. I should say 3 to 8 maybe. And all the other testing and extra steps that may be required within your own IVF cycle, meaning if you need to test your embryos for genetic screening. So if there's a history of genetic abnormality in your family history, or if there's a different reason to be testing because of your age, anything that may indicate that's not covered.
So how much is that then? Let's just because we want people to have the real, right?
Yeah, so there's a little variation from clinic to clinic, but ballpark, the biopsy of the embryo, so we go and take a cell out of the embryos and do genetic testing, baseline is about 2,000, but then you pay per embryo that you send. And it can be around $400 or $500 per embryo. So depending on the number you send, you can see how that can easily add up, and you're often looking at $4,000, $5,000 to $6,000, $7,000 there easily.
Yeah.
And that is not covered. In terms of IUIs, because we started talking right away about IVF, but you may not need IVF when you start off, and you may be recommended IUI cycles. So IUI also is partially funded, or as you said before, I liked your term of discount. What is not covered is the sperm wash. So the sperm wash varies a little bit, again, from clinic to clinic, but you can consider between $500 to $800, and that's per cycle. So you usually need more than one IUI. Some people are lucky, get pregnant on the first try, but a lot of people do 3 to 6 cycles. So easily each time, if you're putting in $700 to $800, you can see how that easily adds up. And if you don't get pregnant, you haven't even started IVF at this point.
Right. And then so how much, okay, we need to also discuss how much these costs are when we don't have any kind of funding. So how much is IUI itself, the procedure? Is it like $1,000 right now, or I'm not
right. Right. That's a good ballpark. Plus the sperm wash, right? And then
plus meds.
And plus meds. So the meds, if you're taking oral medications, usually they would be covered by insurance or by OHIP if you're using that. Even if they're not, the cost is quite low for the oral medications. But if you're using injectables, then it can easily be around $100 per day of injections, and you may need many days. So again, depending on medications and depending on your coverage, if those are out of pocket, easily you can have about $100 a day, and you may need stimulation for 6-7 days, right? So that adds up.
What I found interesting was when I was going through it, because we didn't have the OHIP funding yet. So it was a big deal for me because I was like, oh my goodness, from going from IUI to IVF, I think I'm just going to keep doing IUIs. And so I probably could have saved a lot by skipping the IUIs and going to IVF because I have polycystic ovary syndrome. So in my case, I have lots of follicles and the quality aren't great. So, but didn't know that lesson learned. Maybe in certain scenarios, it's better to kind of bypass doing as many IUIs as I did. I remember thinking how disappointed I was that my health insurance at the time had a lifetime cap of like support financially, like how much they would offer. So that is something I think in Ontario that should be pushed. We should push for more health insurance coverage for meds, not lifetime caps. You're paying through work for your health insurance, and if you have this condition of subfertility, so we ideally would get as many medications as we need and get that 80% coverage like every other medication. I don't know if you see patients struggling with that lifetime cap.
Yes, absolutely. And to your point about doing more IUIs because you're afraid of the cost of IVF. So we have these discussions regularly as well, meaning what are your chances if you do 3 more IUIs? What are your chances per IUI to get pregnant? And again, this depends on what you're coming in with. So you're talking about PCOS, very different from somebody who's coming in with a different pathology. But I have these discussions where I say, well, let's say you try 3 more IUIs and you don't get pregnant, you're going to spend this much. Whereas if we go straight to IVF now, your chances of conception are going to be much higher.
Way higher.
You may also have embryos to bank. So if you want a larger family, or if you failed the first one, you'll have more to try. Why don't we take this money that you would have put to IUI and push it towards IVF? And I actually never thought I would have these discussions, to be honest, but we do have them because we have to. And yes, absolutely, patients will discuss this capping, and it's completely unfair because then once you've hit that and you need more treatment, then the rest is up to you and is out of pocket. And the stress that adds to patients who are already going through such stressful procedures, physically demanding procedures, time consuming, because we don't talk about sort of hidden costs of fertility treatments, which is lost wages. Because you have to come to all these appointments, all these ultrasounds, these blood tests. It takes time, and you have to do it again and again. And so you're not going to work during that time. And it's on women in this case, because there are more testing to do on women than men. It's just the way it is, right?
Absolutely. So, thank you for addressing that, because that is a real reality. People miss work. I mean, in one way, COVID kind of helped because there's more remote working. So when you do that, they can kind of escape and go to the fertility clinic. But, if you're like in person at your job, it's really difficult to slip away. And then, it's such a private journey. A lot of people don't tell their employers. And so then trying to navigate that in secrecy, and then you're trying to get pregnant, but you don't want to lose your job, and you're actually serious about your job, but it may look like you don't care about your job because you have to go to work and you have to go to the fertility clinic.
And you keep being absent. Absolutely. Yeah. And people don't know why. And you're not sharing, right? And also, I think patients are very private about this, even with their family, depending on what the structure of the family is, what the pressures are to get pregnant, and it's not working, and they don't feel comfortable telling their family why. But sometimes that affects the financial aspect as well, bizarrely, because family would maybe be able to help, but they're not aware. And so they can't help.
That's
and patients don't want to share in that. And I completely respect that, but it's another aspect that people don't think about. And it adds to the stress because you're isolated. It's an isolating condition. People go through it alone or just with their partner if they have one, and that's a strain on the relationship as well, because you're only discussing this with this one person and maybe with your healthcare providers, but not with friends or family, because you just don't feel comfortable, so you don't have that support.
Now let's move on to actually we didn't cover this. How much is the real cost of IVF itself. Yeah, let's circle back
Because
to
you
that.
talked about the funding and sort of what's left over for you to pay if you do access this funding. And also what I want to mention is accessing this funding, right? Because it is available for everyone under 43 that is Ontario resident, but there's a but. When is your turn gonna come, right? And is it gonna be soon enough? So sometimes people don't use the funding because they need to go faster because a cycle is not available. So the clinic where they're at, they're done with their funding that year, and so you would have to wait another year. And so you're getting older, time is passing, and all of those things affect your success rate. And so you decide to go out of pocket because of the need to do the treatment now, because it is imperative to do it now. So the funding, yes, is available, but it's not a perfect system. We're happy to have it and we're fortunate, but people have to understand that it's not, you want one now and you get one now. It's not the case.
So then what is the case? What is the reality of, I want to get IVF funding. I'm going to the clinic. What is the expected wait time currently?
You get on a wait list that is the wait list of that clinic, because each clinic gets some funding assigned to them, and it's only the clinics that existed when the program was put in place. So you may go to a clinic that doesn't have funding because the clinic was created after the program. So when new clinics have popped up, the government does not redistribute the funding. So that is another that some patients don't know. Absolutely. So you may go to a clinic that doesn't have funding. You will find out pretty quickly, but maybe you've already made some links and you already have a good feeling there and you're comfortable, but now this clinic doesn't have funding, so you may have to switch.
Can they apply for funding?
Right now, it's not available for new clinics.
Wow.
Okay. So this is
that is new.
That some are lobbying for. It's not our mandate with the foundation, so we're really on the we want to provide financial support to help people pay for treatments, and we'll get a little bit to the foundation in a little bit, I'm sure. But some other groups are their mandate is more on the political aspect and trying to see if there's a way to change these things. But right now, this is the status quo. This is the lay of the land, and so we have to live with it. So you may have to change clinics and go somewhere where there is funding. Once you're in a clinic that has funding, there is a wait list. So each clinic has their own wait list depending on the amount that they've received from the government and what they've used up so far. The amount that they receive is based on the history of how many cycles they do. So that they've done in the past. So the government looked at the productivity of each clinic. Is it a big, a smaller clinic? And gave the funding based on the amount of cycles that they did. That's how the program was done. So when you get to the clinic, you'll find out where they are in their wait list. So they may be done for this year. They may not have any cycles for this year. So you can get put on the wait list for next year. And basically, it's a fluid list. It's people come off and come on. So if someone is doing IUI presently, but wants to be on the wait list for IVF in case it doesn't work, if they get pregnant, they come off the list. So somebody else gets bumped up. So that's sort of the hopeful part of it, right? The wait list, most clinics have 1 to 2 years, right? Easy. You come in and you can't have a cycle for another 1 to 2 years.
Well, just to even get a consultation with a fertility doctor, there can be wait lists, right? And so let's be transparent, because you're actually a co-founder and owner of Tripod Fertility.
Absolutely.
So do you have funding in your clinic?
So we right now work with, so our clinic doesn't have our own lab at this time. So in the future we will. So we partner with a clinic who has a lab. So we do our IVF cycles through a partner clinic and they have funding.
Okay, great. So then you do qualify. Yeah. Okay.
We get some cycles with them. Absolutely.
Yeah. So this is where we'll just, say, if you guys are in Scarborough somewhere, is that where you are? Is it Scarborough?
We are, so we're we're North York, Markham, Scarborough limit. So we're
there you go.
404. So we're kind of at the intersection of these three areas. So we get people we get people from everywhere, but this is where we're of course located. So that's the areas we train, I would say. But for waiting for a consultation, some clinics offer self-referral. So we're one of them. So the wait is a little less to be able to get a consultation. Otherwise, if you have to go to a family doctor or another physician to refer you, a little bit longer because you have to get that appointment and then get the fertility appointment. But Some clinics offer self-referral, so you can do that as well if it's available. And the wait time, again, depends on the clinic and how many, patients they're seeing.
That's great.
So did we say the cost of IVF?
No,
No.
you are
Okay.
not able to access a cycle for whatever reason, and need to go out of pocket. So you already used your cycle, or it's taking too long. You're looking at, for an IVF cycle, anywhere between 15 to 20,000 easily when you put everything in. The IVF cycle itself is about 10. Add on the meds and extra testing, you get to 15 to 20,000 pretty fast.
So you hope you have health insurance for the meds, and then you hope to get funding through, and if you can't, then you jump in. What are some scenarios where somebody might need to kind of just pay out of pocket and maybe get on the wait list in case they have to do a second IVF? What kind of scenarios would you encourage like a patient to just kind of not wait for the funding, and then maybe look outside of COHIP funding?
Right. So, and then I'll talk about other options as well that are available to help people fund their cycle.
Yeah.
But what we encourage, if people need to go faster, we still put them on the waiting list for a cycle, just in case if they pay out of pocket and that cycle doesn't work, they're already on the wait list, because you can still access the OHIP funding even if you've done an out of pocket cycle first. So it doesn't mean you have to do OHIP cycle first. So when would I encourage patients to go out of pocket because they need to go faster? Typically, it's when age is an issue. So usually female age. So if the patient is nearing 40, past 35, nearing 40, definitely if you want more than one child. So we're talking, if you're starting off at 38 and you're going to go through IVF now, and let's say it may not work, you'll need another cycle for your second child. By the time you come back to have your second child, you might be over 40, right? So definitely when age is an issue, when there is a low ovarian reserve, but in a younger patient, so patient is younger, but we know that the egg reserve is low. So we know that we're sort of, it's as if they were older, right? And then if there's a male factor as well that is progressive. So again, if we see a semen analysis where the numbers are lower, and we know that it's something that is evolving with time and that it may get worse, again there. But in that case, you can also freeze sperm. So you do have other options where you can freeze the sperm how it is now and use it later. So you don't have to move to an IVF cycle faster. But the main reason usually is age.
Right.
When time is against us.
And I'm also thinking of the scenarios. I mean, this is very specific. So, a person has stage 3, 4 endometriosis, they have surgery, and then there's typically, it's like, oh, it's better to try to conceive earlier, right? And so rather than waiting, so maybe doing it
like
then.
a recurrent condition.
Yeah, because it grows back. Yeah.
Mm-hmm. Absolutely. No, that's a very, very good example. Or fibroids. So
Yes.
sort of a family of something that can recur. So you've had treatment, everything, looks good, everything is under control. Yes, there are medications we can put patients on to keep some conditions at bay, but it's better to take advantage of that window when things are better and harvest eggs at that point, or do an IVF cycle at that point.
So here's the thing. People are, nobody really wants to do IVF, but then, someone like Tanya and I, we both had to. Like in my case, it was blocked fallopian tube. So there's no amount of trying or relaxing that would help. So doing IVF was the only way for myself. And so how would you help people, and how could they offset their costs outside of waiting for that funded IVF cycle? Do you have certain strategies that you advise people to do or take?
So we know that some Canadian companies, some large companies do offer coverage in their benefits. So that's something to look into. Not everyone knows, if their employer offers coverage. So for example, Starbucks does. That's one that I know. So I tell patients to look into that, and more companies are adding coverage. For medication, we have some help that we can apply for patients to have compassionate meds. So some of the companies that make the IVF drugs will provide medications for free for patients if the clinic applies for them, and if we show financial proof that the patients need this help. So that's on the medication side, which is not negligible. That's a huge cost. And then there are different companies that will offer like loans specifically for healthcare treatments or specifically for fertility. So it's important to look into those before you look at sort of regular loans, which may have a higher interest and not helping you in the end because you're just going into debt and you'll have to pay that off later. So benefits, medication insurance, and certain companies that offer specific help for fertility treatments. Aside from that's basically the lay of the land for other help. And then there's Fertility Friends Foundation. This is sort of why we started this, because there isn't that much out there outside of funding out of pocket. So mortgage, loans, etc. And patients go all the way to that and get severely indebted. So having seen that, as we've practiced, my husband and myself, we work together and own the clinic together. We would talk about this issue all the time and wanting to do something about it, and that's how the idea came to start the foundation. It's been in the works for a few years, but we've needed to find the time and find the resources and people around us to help us, because it is a whole other almost full-time job, and it's hard to do that as you're practicing, you're doing your fertility practice. So this is what we're about. This is what we do. So we fundraise to give financial support to patients, families, singles, any applicant, to help fund fertility treatments. We fund IVF, egg donation, sperm donation, and surrogacy treatments.
Wow, that's amazing.
And the other need we saw, which both of you will attest to because you see patients all the time that are going through fertility treatments, is all the allied healthcare professionals, naturopathic doctors, acupuncture, osteopath, nutrition, anything else that patients may need that is an extra cost. And also sometimes they don't know where to start to find these people. That's also part of what our grant recipients receive. So they receive access to these allied healthcare professionals and get a certain number of sessions free, but also then they have access and they know that they can go back to them for that support.
Wow, that's amazing. That's unheard of, because I've heard of other charitable organizations. So actually, Tanya mentioned it earlier, and I've dealt with patients that was using them, like in the Jewish community, there's a charitable organization that I haven't heard them adding in the allied services. So that's fantastic. Yeah.
I'm not sure you, I don't know, but there is definitely one in the Jewish community that provides funding. I think it's financial help. I'm not sure about a support program. So they may or may not have that, but we definitely do.
So if we donate, it's taxable, like you get tax, like it's registered as a charity, and you can use it for a tax exemption, I'm assuming.
Exactly. We are a Canadian registered charity, and we do everything is tax deductible except if you register for an event. So for example, we have our event yearly. It's the second year that we're having it. Our run tomorrow, Fertility Friends Run, to coincide with the end of Canadian Fertility Awareness Week. So it's a fundraiser, and it's happening here in Toronto at Oriole Park tomorrow between 11 and 3. So there's a run or walk, so no pressure to run. It's a 5K, and there's also a kids event at 1 o'clock. So kids run just 1K, and activities, food, etc. It's a community event. And so if you do register to be in the run, then you can't have a tax deduction because you're registering for an event. Any donation that's not related to an event is, of course, tax deductible.
That's amazing. So how do people find you in terms of looking into this charitable foundation and trying to offset costs?
Yes. So we are on, so we have our website, fertilityfriendsfoundation.com. We're also on all social media. And again, same handle, Fertility Friends Foundation. And you find all the information there for donating, for any upcoming events, such as the one I was talking about before, our event tomorrow, but also how to apply. So the way we work is we have 2 application cycles. So we do one in the spring and one in the fall. So we're currently in the spring one. also coinciding with Fertility Awareness Week. But the application time is for a whole month. So the portal is open for a month. And that you will also find on the site how to apply, and the application form is there, as well as support documents that you have to attach to your application. Our contact person's email is there. She's always available answering questions for applicants in terms of eligibility, technical problems, what have you. She's excellent, and she's our go-to person for this. So whether you're on the donating side or the applicant side, you'll find everything there to be able to either donate or apply, or both if you'd like, obviously.
I'm on your website right now, and I see you can start a fundraiser as well. So you can, as an individual or clinic. So that's cool. Yeah.
That's very cool. So what we'll do is on our myfertology.com, we'll have the links to how to get in touch with you, either for your clinic at Tripod or Fertility Friends Foundation. And is there any word of advice that you would like to share at this point for all those people that are having challenges going through fertility? What would you like to tell them?
I would like to tell them that there are resources out there. I think that the main thing is that that we were talking about before is that it's very isolating. There's shame associated with it, unfortunately, still in our day. And I think that what I would tell them is to dig and to do their research, because there are resources out there. There are people and organizations that are willing to help, whether they find out through their clinic, through their physician, nursing, any staff at the clinic, or doing their own research. There are more and more resources out there to support you, either if it is for financial support or any kind of other support, like we were talking about before with our support program, therapist, anything that you may need. There are lots of resources out there. And I think it's important not to stay alone. I think it's important to reach out and try to find the support that you need, because it is a very hard thing to go through, and it's important not to do it alone. Even if you're telling your family or people that are close, you may find community elsewhere, and it's there, it's out there, and reach out. And definitely, we're one of those resources, and we're happy, of course, to help and to orient people to find what they need.
So there you have it. And, there are support groups out there, and there are books out there. My book is one of them. I talked about navigating work as well. So, just trying to create hope and instill that this is possible and you're not alone. So, the three of us are here for you.
I was going to say, already just here you have, you have huge amounts of resources, even if it's not directly us that will help you, we will help guide you, right?
I love your website. I think it's outstanding. Thank you so much for that contribution. I think it's excellent. It's much needed. I feel like women who are going through postpartum depression, they have a helpline. I feel like this would be like the helpline, because there is no helpline when you're sad and you're struggling and you're alone, you're going through fertility. Sometimes you're like, where do I start? So this is a great resource. Thank you.
It's so daunting. It's the where do you start? What do I do? And is this going to work? And how to keep being hopeful. And it is through a community, hearing stories, having resources, knowing what other people have done. That's how we keep hope alive, and finding your team. Finding the clinic that fits the people around you, and hopefully they can continue to instill that hope in you.
Yes. And, I just want to give a shout out to Fertility Matters Canada as well. And they're doing lots there to help people. So kudos to you, Carolyn, if you're watching this. And also there's a Canadian fertility show. So all of this is to help people navigate. I don't know if you're going to be there at...
Unfortunately, I'm not personally going to be there, but Fertility Friends Foundation has a booth.
That's right.
Right. So for people that are going to be present, they will be able to go up and talk to members of our board, actually. So we have an amazing board and people that we've assembled that work with us and help us do this great work. And they'll be present at the booth.
Okay, perfect.
On May 13th, I believe it is.
Yes, it's Saturday, May 13th. I'm actually going to be there. Alive is going to be there. Tanya, I didn't even ask you. Are you going to come?
That's the plan.
Okay, yay.
Yeah.
I'll be speaking there too. So come see Dr. Tanya and myself, and also go reach out to fertility friends, and you get the help that you need and deserve, and we shall see you real soon. And then otherwise, in between, go through our My Fertility podcast, because we've got a lot of good stuff to help support you on your way. And my book, Pathways to Pregnancy.
And in terms of the, the clinic, obviously at Tripod Fertility, if you need to find a fertility doctor, we're here for you. So that's through our website. You can also, like I said before, self-refer, or if you go through your doctor, you can ask to be referred to Tripod Fertility. Myself or my husband are the two physicians there.
Which is awesome, because there's a lot of places that access can be difficult if you have to go through your GP and then get the referral, So this is like just go straight to you.
Is that new? Sorry, I know we're kind of out of time here, but the self-referral?
It's different clinics.
Yeah, it depends on the clinic. Some clinics offer it and some don't. We've been offering it since we opened, since the beginning, because we feel that it cuts time.
Yes,
great to the physician. So it's kind of nice.
I love it.
Yeah.
True patient-centered care. Thank you. This is much needed. So thank you.
My pleasure. Thank you so much for inviting me. This was great.